Is there a case for drug decriminalization?
Of course there is. When we talk about drug decriminalization, we're basically talking about making sure no one is being arrested for putting drugs in their bodies, for using drugs, for seeking pleasure. We're just making sure that that's the case. That's quite low level. Any idiot would say, of course there should be there's a case for a decriminalization. But it's more complicated than that, because when we think about drug decriminalization is good in that no one should be arrested, but it doesn't address issues related to, for example, contaminated drug that people may buy on the streets. You may buy, I don't know, some drug that you think is MDMA when in fact is something else, and it might be dangerous. And so drug decriminalization doesn't do anything to protect the user, besides making sure they don't go to jail, which is fine. Many wealthy people don't have that problem. They don't have to worry about not going to jail anyway. It's poor people, and those people are the ones who have to worry about going to jail. So the notion that there should be a case for decriminalizing drugs, that's easy. Of course there should be a case. But when we have this conversation, these issues get conflated. For example, we see people who are struggling, people who may be resource poor. They don't have housing, they have limited education. And then we see the problems that they face, and then we attribute those problems to drugs, which is nonsense. And it's a way for politicians not to really address the issues that poor people face, because we know that people of means don't have those same problems when they use drugs. When that happens, that tells you that it's not the drug. You have to look beyond drugs. But when we have this conversation, people who are talking about changing drug policy, now you're being asked to fix all of society's problems, and that's unfair. And the conversation gets sidetracked onto something else. The conversation really should be as we have this conversation, we should really think about liberty. We think about people who are allowed to drink alcohol. Alcohol is a drug. Alcohol, in some cases, is more toxic to many of the other drugs. But this is not an argument to ban alcohol, because I think alcohol, of course, should be legally available and regulated. We have quality control. We make sure the government inspects the alcohol so we know what we're getting. The government controls the unit dose, how much is in a bottle. All of that enhances safety. We can do the same thing with other drugs. And so the question becomes, why are we treating one chemical differently than the other? I understand that people say, well, this particular chemical, heroin or something else, is far more dangerous than alcohol. Well, that's debatable, and it's probably not true under most conditions. And so if we think about liberty and people's right to alter their consciousness, to put what they want in their bodies if they are adults, what we're doing with drug policy is silly, and also it impacts our liberty. But we have to ask, well, why are we doing this if it's silly and if it's limiting people's liberty? Why are we doing it? Well, we're doing it because prohibition actually does work. It works for a select group of people in our society. It works for the police. It works for the politicians who can say, we want to we're going to solve the problems of your community. We're going to put more cops on the streets, and we're going to get drugs out of your community. And those politicians look like heroes, when in fact they are zeros and they're not heroes. And so a number of people benefit from prohibition. And that's why we continue prohibition, because if it didn't work, then we wouldn't continue it. But so many people are benefiting, and we have to talk about those people who are benefiting and the people who are suffering. The people who are suffering, for example, are those people who may get a drug that's tainted with something else, and that person dies, or that person gets maimed, or that person is really injured severely. Those people are not benefiting. And the people who go to jail for drug laws, they're not benefiting. And most of us in society, we're not benefiting because the money that supports the war on drug or prohibition is coming from us, but we're not benefiting from the money. But a number of other people are benefiting from the money. And whenever we have this conversation, we have to make sure we discuss the folks who are benefiting from the current approach. Because if no one was benefiting from the current approach, then it would stop. The fact is, a tremendous number of people are benefiting from the current approach. And I think that I'll leave it there and we can continue the conversation.